All right. Thanks, Joe. Before Mina leaves, I just want to thank her. Not every area has as much coordination on EHV as you are getting here in Southern California, and that I don't want that to be lost on everyone. That's a really important partnership that others are kind of screaming for. So thanks to Mina and her team.
I'm in a meeting right now. You couldn't tell from the screen. Multitasking. No worries.
Hey.
All right. I'll jump into the count update then.
Thanks, William.
By way of update for the count, so as of right now, we are expecting to conduct a 2022 count. We are anticipating all communities will do it. We're not forcing it, although you can see through the NOFA that we certainly are incentivizing it. And I think for local reasons, I think it would be hard for a community not to do a count. Many of you didn't do a count last year, so actually you will be forced to do it this year with some caveats I'll mention in a moment. But if you didn't do a count last year, full count, you should absolutely count on doing one this year. That will fall into place. We don't, at this point, anticipate doing any kind of general waiver like we did last year. We are talking with National Healthcare for the Homeless and CDC and kind of thinking through the COVID situation, right? Nobody actually knows what's happening right now. The trajectory in terms of COVID positive rates is down and looking like it will go down, but we all know that could change in weeks or months, and predicting January is impossible. So because of where we are now, we are just going to count on it going forward and anticipate that we will be doing a count. A couple of things to notice there. So we are working on a new notice or an updated notice. Most of the notice stuff will stay in place, but there are a couple things that we'll address in the notice. We'll make some mention of tribes, right? That's going to be a very real part of the next couple of years, figuring out the interaction between tribes and COCs. It's going to be important, so we'll make reference to that. EHV, while it is not required to enter EHV data into HMIS, we are requiring EHV to be included in the HIC. So you should anticipate now that you will need to report on that. You'll note, if you've seen already, when people ask how to set up those projects, we do have some guidance already. And we're generally saying you should be setting it up as other permanent housing, one of the two other permanent housing project types, even if you're just doing the project descriptor data elements and not really collecting other data. We have gotten some strong pushback from some communities who want to set it up as permanent supportive housing. This is what we've said, and there's implications all the way through everything else we do. If you report it as other permanent housing, we are going to do our best to stand very strongly next to this. You don't have to have it in HMIS, and carry that through in all sense of the word, right? So one of the fears folks have, and rightly have, is, are you going to say it's not required, but then in some other mechanism going to require it, specifically on the HMIS bed coverage side. At this point, while we're going to require reporting on the HIC, we really don't anticipate requiring it even on the HMIS bed coverage side. But if you report it as PSH, it will need to be part of your HMIS bed coverage. And the large reason is because it ties to so many other reports that you do. Most importantly is the LSA, but certainly the system performance measures. So we tried to say, put it as other permanent housing because it gives us a way out of forcing you down the roads of the other reports, and can easily say you don't have to do HMIS bed coverage issues, or you won't have HMIS bed coverage issues with it. So I just want to flag that. I don't think most people have argued with this other permanent housing piece, but again, we've had a handful who have very strongly pushed back on that, and that's been our stance. We are trying to flesh out in the notice as well a couple of other situations that commonly come up. I think this group, we've talked about several of them, right? We'll talk in a little bit about RVs. So we're trying to put some RV language in. Things like tiny homes in the variety of alternate shelter scenarios. I was in a conversation with our council today on that. It's not clear what guidance we're going to be allowed to say. I have proposed guidance there. That actually is the very last issue we have to resolve. Once that's resolved, the notice will be ready to publish. So we're just working with them on what we're allowed to do here. There are some guiding principles we've used in the past, and we want our council to sign off on that and be able to put it in the notice. So we'll see if those make it in the notice, but they should be very helpful. There will be a little bit new stuff there anyways. We try to address some things like tents, again, cars, RVs. Not a ton of depth, but certainly touch on things. With the counts happening in 2022 and most, if not all, COCs doing it then, if I were you as a COC and kind of trying to guess what's the on year, what's the off year, we're essentially going to do a restart with even years. So most of you at this point actually do counts every single year. If you don't, though, I would count on using the odd years for your off counts or where you don't do one. That actually lines up well with other things like census. I'm already talking with the census about the 2030 counts. So that helps with some of that conversation also. We put out a few new resources in regards to counting. I think it was maybe 2 weeks ago, we put out a sampling tool. There have been a lot of questions around how to do sampling, and then I'm more worried about the questions I'm not getting, but the data I'm seeing. There's lots of things that people don't understand about sampling. So it took us a while to kind of loop around to how to do a tool that might get at this. It's a good idea if you haven't looked at that to at least open it, get a sense for what that tool does. It'll help you set up a sampling regime up front, or if you already have one, it'll help you do estimates on the back end to try to do stratification and building that into building a stronger estimate and a more consistent one. So I know that'll get to one of the questions we have later, but I'll touch on it briefly here. One of our concerns is folks talk about change in like volunteers and how that impacts the count. While that's always going to be true to some extent, I think a lot of that can be mitigated with a strong sampling strategy, right? Because more volunteers typically allows you a deeper penetration into more areas. Well, if you sample appropriately for all of the areas, then more volunteers gives a kind of added assurance, but it shouldn't alter the nature of your count drastically from year to year. So again, we're hopeful that this kind of sampling tool will assist even when there's volunteer variability over time. It'll make that a little more even keel for folks, which is really important. I think I'll stop there. I think those are the main things going on. And Joe, you had a series of questions.
Yes, here they are, William, coming right up. Number 1 and number 2.
All right. Is there a possibility to do a partial sampling of your area in case that we don't have enough volunteers? So I partially touched on that there, right? Technically, that's always available. You always have to report your count at the entire COC level, right? So it's always a COC level count. The amount of areas you count in your counts, well, that's going to vary from year to year depending on who's at play, volunteers and whatnot. So a good plug for using that resource or some other methodology that allows you to account for every area, and that should mitigate the impact from volunteer variance from year to year. So again, plug for that tool. The second question, what about counting vehicles and what about the use of a multiplier? So this is no different than what we talked about in the past couple of calls around this. You can extrapolate when it comes to counting vehicles, but you can't do that unless you've already derived a sample based on talking to people in those vehicles, right? You just have no idea about who is homeless, the nature of that homelessness, right? Is it one person? Is it multiple people? You can't possibly know that without knocking on a few doors and finding out some information. So a multiplier, you could have a multiplier, but it would be based on your own sample to determine what that looks like. And if I were you, you kind of have two layers that you adjust, right? You would, if you had 100 cars you counted and you were able to talk to 10 people in those cars, you're going to adjust for how many of those people said, no, I'm actually not homeless. So that's your first piece, is figure out that factor and adjust all 100 by well, it turns out 70% of those folks actually are not homeless. And then at that point, you'll run the layer of, well, how many people were in those vehicles? So it is possible, again, to use that kind of multiplier, but only if you've done the work in figuring out who's in those vehicles in the first place.
Hey, William, I'm going to ask Tamara, and I know that you were working with San Diego in the past about the multiplier, and then I want to ask Tina from LA too. I know that we're counting vehicles and the use of multiplier is important, so I can imagine that they have some things to add at the moment. Tamara?
Thank you, Joe. We actually haven't used a multiplier for a number of years. We do a kind of the methodology that we don't count vehicles, we count people. So if we see a vehicle that we think may have a homeless individual, trying to knock and talk or identify it and return maybe later in the day, and also trying to at least identify that, you know, if there are individuals there, not just stuff. We also do a similar approach on the RV. So I think the RV guidance will be really helpful, William, but I think, you know, we've really stepped back quite a bit from a multiplier to a purposeful approach. If you are counting people in vehicles, trying to talk to them or see an individual before you count someone in a vehicle. And I think the conversation with the individuals has been really helpful for us.
So Tina, Clementina, LA?
Yes, hi, William. Yeah, so for LA, we still continue to utilize the multiplier and do count vehicles, RVs, vans, etc. So we get that information through the demographic survey process. So, you know, part of the question is whether individuals are staying in any of these dwellings, and if so, how many individuals are staying with them. So then we utilize that information to come up with the multiplier. We're continuing to use that methodology for 2022.
William, back to you. About vehicles and multiplier, anything else to add?
So what Tamara shared is ideal, right? It's ideal to be able to engage folks in vehicles. I think Los Angeles is a good example of that. Sheer volume may make it so you can't do that. Although I would say something to check, Tina, and you probably already have this in there, but it is that issue of, if you're going to count vehicles, you also have that first factor of how do you discount the vehicles that don't in fact have homeless people in them, or when you talk to them, they turn out they're not homeless or empty, right? When if they're empty on the night of the count, we would just count them as not homeless. That's a tough factor to get when you just have a number of vehicles in front of you. So I'm not sure that you can get that out of the sampling approach that you have, but you might be able to. But something you'll definitely want to consider, because it'll overinflate your count if you're not able to adjust for that.
So I'm going to stop us on this at the moment, because as you can imagine, we can take the rest of our time just talking about counting vehicles and the use of a multiplier. So William, the next couple questions, there they are.
Yes. So why did we include the two questions? I think that answers its own. Like, the why is, well, because we want you to do it. And there's no better way to do it than to say, hey, you will get points if you do it, and you won't get points if you don't. So all of that is just steering people in the direction we want them to go.
And that ties into a comment that you made earlier about saying that we won't be saying that you have to do an unsheltered count every odd number year. We're going to be switching over that everybody will be required to do an unsheltered count every even number year, correct?
Yep.
Okay, so we would get 3 points for that as well. Then the next question 4.
So the question is, what does HUD mean by the following two statements in the NOFO? And it's focused on, well, it's really saying we're going to look at the shelter counts. All this is doing is saying we know that either you didn't do an unsheltered count, or if you did one, it likely has some issues, and not that it's going to look different from last year. So we're just going to ignore that for this year. And we're going to focus on the shelter data. The shelter data, I will tell you, is fascinating. I have been reviewing that. I don't know when we'll finally publish it, but it is in many ways surprising given the amount of resources out there. So that's, I had expected everyone would like to gain some points off of just comparing shelter from one year to the next, but that might not be the case. There wasn't a level of increase that I would have expected. In many areas, it was actually a decrease. And so some of that has to do with shelter decompression. A lot of it has to do with where and how NCS came online. So a lot of interesting factors there. But this is all about that concession that there's no value in us looking at unsheltered data this year. And it's really low in points, right? You guys have seen in the past the pit count crossing several questions at a ton of weight. Well, this year it has 1 point. I think that's what the NOFA says. It's pretty low.
So, and then, William, with letter B about plans to measure sheltered and unsheltered populations in 2022, one of the reasons of putting this in is because this seems to suggest that next year the 2022 NOFA would have all those points. You know, historically, you had up to 40 points in the consolidated application related to whether if your homeless count decreased or not in certain categories, and then you got all these points up to, I think it's as many as 40. And then it seems like this is suggesting that you have plans to measure sheltered and unsheltered populations in 2022. And so if we have the 22 NOFA in front of us, you know, maybe there's all these points tied to that again. And if you didn't do a count in 22, you would be left with what? Measuring your 2019 count, comparing it to your 2017 count or something like that?
Yeah, my head doesn't want to go to what we'll have to deal with if there's not a count, but yeah, these are very strong incentives. I can't tell you how many points in the future there will be. I actually have no idea what we'll end up doing, but you can rest assured that there will be a heavy emphasis on what we see in that 2022 count, certainly more than the 1 point you're seeing this year. So it's, yeah.
And just real quick, I know that in Southern California, that historically an annual unsheltered count was done by 11 out of the 13 COCs, and SLO, San Luis Obispo, and Orange County were only doing it every other year. But this year, Orange County and San Luis Obispo, right, Laurel, are doing a unsheltered count. So you have all 13 in Southern California. Now, just a real quick shout out, you know, Doreen, I know on Fresno, Madera, are you guys planning on doing the unsheltered counting this coming January?
Yes, this is Jody. Yes,
Okay.
we are.
Oh, Jody, yeah. Hey, Jody. Miguel, King Solari. You plan on doing one?
Joe, I can speak to that. This is Laura Fisher. I'm the program manager.
Oh,
for
hey,
the
Laura, I didn't see your name.
Alliance.
I was wondering if you were on.
Hi.
Yeah.
I'm here. Yes, we are planning to do an unsheltered count this year, or in 2022.
Okay, and so for the three counties, Alpine, Inyo, and Mono, Topa, is that how you pronounce your first name? Did I say that correct?
Yes, that's correct.
Yeah, Larry's not on the call, so asking, are you guys planning on doing an unsheltered count?
I believe so, but I just started my position, so I'm just kind of learning everything. So I'm not sure what our plans are on that right now.
Okay, and Roxanne, I don't know, Monterey, San Benito. I'm scrolling up and down, seeing if she was on the call here.
I am. Hello, everybody. Okay. Yes, we are going to be doing a 2022 count, and we're just trying to figure out how to do it under the circumstances. That's all.
Okay, so you got, it looks like you'll have 17 out of 17, William, in concerning us. So the next question, the last one, before we go to other questions from COC leaders, William, question number 5 on the screen.
Right. Are youth in YCB host homes, costs for which considered support services included in the PIT as sheltered, or are they not counted because their permanent homes. So it actually depends. There's not a straight answer for this because we see tons of variation on the model, even within YHTP. So if you are a YHTP grantee, and I know we at least have one on the phone, San Diego, and Los Angeles will be one in the future. Congratulations. Yeah, we'll just have to look at the circumstance, and that's one writes in the question in. For the most part, we see them as a form of rapid rehousing, but again, that's not uniform. It just depends.
And so, William, Pat Leslie was the one that wrote this question. Pat, don't say anything now, but how about if you correspond with, do a follow-up with William via email, and then we'll share it with everybody, just to kind of flesh this out a little bit more. Pat, William, flesh it out a little bit more then.
Sounds good.
Okay, Lynn. All right, other questions from COC leaders for William. And Tina, I'm kind of going with those of us that have larger populations, but hey, you know, Kim, Santa Barbara, Terra, Ventura, we're going to get out to you guys in just a minute. Deb, I know you're on from Kern County. So Tina, anything else for William real quick?
Yes, I just wanted to confirm what guidance HUD will be providing regarding the pandemic. Specifically, we were wondering if HUD is or was planning on asking information related to COVID and its impact. Just want to make sure that if it is going to be asked, that we have that question in our demographic survey.
Great question. No, we're not going to add any new questions at this point. As far as I have seen in the notice, no proposal to do that.
Okay, Tamara or Lahela, San Diego. Either one of you, quick question?
William, maybe it's a little bit of a comment and a question. With all of the new funding that's come out, now the emergency housing vouchers and potentially more, there's a pretty heavy burden on COC's HMIS staff to develop all of these new programs, reporting requirements now for, number of years. But our HMIS grants have remained flat. Is there going to be any opportunity down the road to increase support for continuums of care who haven't got funding for all of this increased, expectation, report outs, and the lift on HMIS?
Yeah, that's a great question. So if you look at at the HUD FY22 President's budget, right, our congressional justification, which I'm sure all of you have pored over and memorized, that document actually has a request for $316 million above what we asked for, or above our renewal demand, just in the category of there's about 4 parts to this category. But one of the things, part of that $316 million would be to increase HMIS budgets. Another would focus on coordinated entry. Another would focus on street outreach, and another would focus on supportive service connections with mainstream housing, which you could quickly read between the lines, a connection between this and EHV. So I can't promise you where that's going to go, but we hear you loud and clear, and we've made our request that that type of funding be provided and try to tie it to these resources, though quite frankly, if none of these resources were out, the burden that's been attached to these programs over the last couple of years is enough to make that request. So, yeah, we'll do what we can on that one and look forward to support up on the Hill for that as well.
And just to follow up, Joe, I think it's important that we as COCs, where we can advocate for this, I'm just going to add a little bit to what William said, that we are advocating for it because it's in there somewhere, but you need to know what we're advocating for. And I think we can show the added expectation, burden, and outcomes that are required through the data and the support.
Okay, then. All right, Tamara, we'll move on to, there's a quick question, Roxanne, Monterey, San Benito, you were just saying about, can we count over 2 days? And the answer is yes, William, right? With a couple little caveats.
Yeah, I mean, the real biggest caveat is, are you doing an interview? If you are, then yeah, you can count actually up to 7 days. If you're just doing an observation count, generally no. Though there are some exceptions we can explore if needs be.
And a survey base means the unique identifier, correct? Creating that, yeah.
Well, at least, yeah, right. Generally, we think it's the larger survey that would include all the elements required.
William? Oh, no.
No, yep. Did you hear my
William,
response there?
No, we lost you for a few seconds.
Yep, I was just saying, yes, the interview is the key there, and it's, yes, the deduplication factor is the key. You're likely going to interview to all of the factors at that point, though. But we can explore. If you're not doing an interview in your count, Roxanne, then that's something we'll just have to talk a little bit further about.
Okay, because I want to keep us down. We got about 20 minutes left before we switch over to Helene. So go next to Zolima, Orange County, and then Tanya, Riverside, COC. So Zolima, Orange County.
Thank you, Joe. I don't have any questions specifically.
Okay, okay. Tanya, Riverside.
Hi, Joe.
Or Laura.
Yeah. Hi, Joe. Hi, William. I think our question mainly focuses on the points around the decreases to the sheltered count. I just want to make sure I understood that correctly, that the HUD, right, that we would be measured based on the sheltered count this year. And the reason I guess I'm stressing that is this year, like other communities in California, we launched Project Room Key, and we saw a 26% increase in the number of sheltered individuals in comparison to previous years. And we feel good about that because we've been able to already connect a lot of those participants to permanent housing. So I just wanted to see if you could expand on that, just so I can make sure that, you know, we're sort of keeping in mind how we answer that question on the application.
Yeah, well, to be honest, there's nothing you'll answer on that part of the application. We're literally just looking at the data. And so for that, though, we do we'll exclusively look at your shelter counts and the impacts that has. So the selection criteria in the statute in section 427 talks about required reductions in homelessness. So that's what we'll have to measure. It's, did you show reductions? And our only touch point this year will be in the sheltered count. So again, that's knowing all of these factors are in play is a big reason why it's only 1 point. We actually have no choice but to have some points tied to it. So we just minimize the impact as much as we could.
Okay, thank you, William, and that, Tanya. So Mike, San Bernardino, COC.
Good afternoon.
Quick question, Mike? Yeah.
No questions from our side. Appreciate all your time.
Okay, so before we go over to Ventura and Santa Barbara and SLO and Kern and a few others, real quick on the cities, scrolling down. So Jenny, Pasadena, quick question. I don't know if Jenny,
I'm sorry, I lost it.
Okay.
I did not have a question. Did you have a question for me?
No, I just wondered if you had something for William. So.
Oh, I see. No, I don't. No, thank you.
Okay. Phil, Glendale, I see you're on the call.
Yes, thanks. No question from me.
Okay, Paul, Long Beach.
Questions for me.
Okay, so then why don't we go to Ventura, Tara?
Hi, Joe. Hi, William. I just wanted to ask if there would be any additional updated guidance related to using mobile apps or online survey tools, any concerns or updates around that? I'm assuming that we've been doing that for a few years now, so just wanted to confirm.
No updated guidance in the plans. Strangely, the document we put out, I don't know, maybe 4 years ago after we did the beta test, we don't really have different set of feedback. It's a lot of confirming the same things we see there. I think the catch for the mobile apps, and we've seen a lot of success there, but the catch is like finding one that works for your community that you can also afford, because some of them certainly are expensive and others potentially are not, depending on how you're getting them funded through your county usually.
Right. Okay. We're thinking about transitioning to using our county's Esri, GIS system for better mapping and resources. So, and already have that. So it wouldn't be necessarily, it actually would be more affordable since we are a county. So, okay. Thank you so much. Thanks for the guidance and the updates. Appreciate it.
Kim, Santa Barbara.
Hi, everyone. Yeah, a couple of quick questions. Can HUD provide additional guidance on how tiny homes or dwelling units are to be included in the HIC? And William, there was talk of an unsheltered NOFO pre-COVID, and it seems like it got lost in the shuffle. Is that still coming?
Let's see. So let me take the tiny home one first. So I will say that the tiny home question was like the crux of our discussion with council today. I'm hoping to be able to say some things in the guidance in the notice that we put out. We'll see, because that's the thing that they were a little hung up on. So my goal is to, though, because tiny homes have several layers in how you can look at them, and we would like to approach it from a first, could you count them as shelter, and then add the layer of, well, if they're at least shelter, are they ever permanent housing as well, which is a whole nother layer. So we'll see what makes it in the notice, but certainly exploring that. The unsheltered NOFO is absolutely in people's minds. We are moving forward. Our concern right now is COC capacity, right? Can you imagine taking on another NOFO, something that you're not going to be able to just refresh a lot from last year, but this is all new, different partnerships. It's going to be a little bit of work. So we're just kind of biding our time a little bit, trying to take some lessons learned from COVID as well in the unsheltered space. But it is moving along. We had discussions in the last week or so about various criteria, and it is moving up the chain.
Okay. Laurel.
Thank you.
San Luis Obispo.
Hi, Joe. So George and I wanted to check back in with William just about timing of the pit count, and obviously with COVID, last year January was peak time, and hopefully the vaccines will help, but there's also some evidence that folks are going to need boosters to avoid breakthrough. So I know that we just had a meeting with our data folks this week who are working on the pit count, and they were kind of hoping that we'd be able to move it back a little bit to February, March, when it's less likely there's going to be a huge spike. But anyway, I guess I was just going to say, William, that based on what we saw last year, communities typically see spikes starting after about 2 weeks after Thanksgiving. So that might be a good time to kind of really look at that with CDC and others to see which direction it's trending. But the truth is too that the biggest spikes generally occur about 2 weeks after Christmas. And so hopefully we can be in conversation with you all, just as all of our EOCs and public health agencies are monitoring all of this and be able to move kind of quickly if we do need to move it due to spikes. And there may be some regional differences as well. So maybe working with some of the CDC or other folks to maybe come up with some criteria if your hospitalizations are over a certain rate or something, or at least just plan to have a follow-up maybe the HUD Friday office hours or something, but let us know come January what it's looking like and how we might need to go about requesting a change in date if needed.
Yep, so that's exactly the type of conversation we're going to be having with CDC and National Healthcare for the Homeless. I will say you can request an exception to the date now. You can request it to go to February. The one rub there is that's only a request to change the date of the count. It doesn't change your submission timeline. For some COCs, that actually doesn't matter, right? They don't need the extra month to collect their data. So typically we wouldn't push it out like a week. We'd push it out a month for most of those PID counts that move out. And if you want to do it in February, if most of your conditions are about the same as January, which in California it often is, it's ideal to do it at the end of the month. That's when most like rent checks and other subsidies and other, right, like both bills start to pile in and assistance kind of flows out. So that's the only thing to consider, but that's in the notice that's already published, and we're not going to change the guidance there. You can request the exception. It'll actually go through a different email box, but it'll be requesting the exception, providing cause. So if that's something you already want to anticipate and you don't want to have to wonder what's going to happen in January, you can push it to February. And again, just know you'll probably have to submit your data by April 30th. But we are looking at like the types of factors that should be considered. What I think will happen, unlike last year, where we provided exceptions to the counts altogether, we probably will look at doing, again, maybe head counts in those areas where it's more difficult to do. We'll run some kind of traps before we just say no count at all in spite of COVID. So that's the type of discussion we'll have with CDC.
Okay. We're okay on that. Then there's still a few more COCs, and we have about 10 minutes before we switch over to Helene. So with that, Deb, Kern County COC. Deb?
Thank you. I don't have any questions at this time.
All right. How about Madera, Fresno, Doreen, Jody?
Yeah, I just have one question, William. Why NOFO? What prompted that? I just have to know.
That's a great question. I wish I had the answer. I think we were forced by some audit or something. Yeah, we don't love it either.
Just curious.
Okay. So how about Kings Tulare? Laura or Miguel?
We don't have any questions on our end. William did a good job of answering our concerns. Thank you.
Okay. And Topa, I know we never met. Just exchanged anything for your Tri-County COC? Any questions?
No questions at this time. Thank you.
Okay. And Paula, I know you thought I forgot you in Imperial, and I did, and shame on me. Paula.
No problem, Joe.
All right,
no,
you still
Joe,
love me? Okay. All right.
We do.
All right. Okay. So with that, I just kind of scrolling down a little bit. Jeanette, Senator Feinstein's office. Jeanette, you're still with us, right? Any quick word, something you want to say, add? Jeanette? Okay, maybe we'll come back to her. No? Jeanette? Okay. With that then, George, did you something that you noted in the chat?
Hey Joe, yeah, one of the questions that came up from part of our planning group was reaching out to some of the COCs that did conduct a full count this year to get any like best practices, lessons learned from doing the count during COVID.
William?
I wasn't sure if that was a question for me or the other communities here, because we have Kern did a count. I think we might have one other on the call here. The things that I saw was that, as with your normal count, street outreach makes all the difference. If you don't have street outreach, you don't really have a count. That's most important in the COVID context. We found that doing counts over longer days we allowed the counting up to 14 days. That was something that seems like it would be helpful on the surface, and not a whole lot of communities found that terribly helpful, because there's still time and staff and recall issue, right? Like, it just results in issues. So it didn't turn out to be as helpful as anticipated. And we also found that sampling, again, was helpful for folks. They were able to learn a little more about how to do that and what that meant. So I think those are the biggest lessons learned. I will say many of the communities that used an alternate data set, there were not many total. I think we had about 20. They generally had to use some other action as well, like engaging street outreach. And so it's hard to see a scenario where communities are going to be doing purely counts out of like HMIS or the coordinated entry data or whatever. I know we've seen a lot of questions about that, but it's not really something that's likely going to be a big thing or very possible in the future. So just in case folks are wondering what direction that's going, that this count didn't put a lot of favor in that, although it showed that there's definitely a good possibility of intersecting the counts with data that already exists.
Okay, so, sometimes we have state representatives from BCSH, HCD on the call with us, and I see some call-in users, and it's generally those. So if we have any state folks, I know, Amber, I don't know if you were on the call or not. You said you were tentative. I don't know if anyone from the state wants to just unmute themselves and jump in with a comment or a question. Any of our state reps, our state partners? Anybody? Okay. So with that then, we're going to just switch over in a few minutes to Helene. So William, anything else to add or say? I have one quick question. When you're saying that the tiny homes is holding up, dealing with the tiny homes issues is holding up the release of the guidance, when would we expect that, for it to be released? Do you have any idea?
Nope. Again, that's the last issue. We literally resolved everything else today. So I'm hoping that's not going to take long. But in my experience, trying to predict when council approves something is like using a crystal ball, and you just don't know what you're going to get. So I'm hopeful, though. Hopefully, my best guess would be next week if they can clear it real fast, which it's not a huge issue. We actually have some headway on this one. So I'm hoping next week, but it could be, 3 weeks. So we'll see.
Okay, anything else you want to add before we switch over to Helene? William?
Nope, just thanks to everyone. Looking forward to the conversation with Helene.